Hi, welcome to Bari Nation, where we support the bariatric community with humor, humility, and honesty.
You've just tuned into a podcast that welcomes you into a community, a resource center, and a safe place that powers your journey towards personal wellness.
Our goal is you leave us today feeling hopeful, inspired, and ready to live your best bariatric life.
Hi, friends. Welcome back to the Bari Nation podcast. I am thrilled to introduce you to an expert and a patient that I doubt you have had the honor of meeting before. Aimee Rothe is joining us today on the show. Hi, Aimee.
Hello, how are you guys?
So good. I had the honor of meeting you 2 years ago. I think Laura Grabo introduced us at ASMBS. And about 5 minutes into my conversation with you, I knew, this is a woman who we need in our corner. You are an amazing professional. You have just taken a leadership role at ASMBS, and you're a bariatric patient yourself.
Yes.
And I know you are on a mission to support patients in the ways in which you know they need to be supported in.
Exactly.
Right? So before we dive into this conversation, will you introduce yourself for our friends who have never met you before?
Yes. So I am Aimee. I am a nurse. I am a board certified bariatric nurse. I've been a nurse almost 20 years. I'm a mom. I am a wife, and I am a post-op patient. I mean, you can be all those things. I'm a provider now. I made the revolution from patient to provider, but I initially had a lap band in 2010, and then I had a conversion to a vertical sleeve gastrectomy in 2017. I was right around day of surgery, around 415 pounds, and I am currently maintaining right around like 175, 180. I got into the healthcare side of bariatric surgery at the end of 2019. Never expected ever in my life to get into this field. I worked emergency medicine for a very long time. And I think that this is where I belong. I want to mix my personal experience being a post-op with the healthcare side and help guide other people through this surgery, because I think that we as patients need somebody in our corner. We need somebody who is maybe not a surgeon, but a program director. And I'm a program director. I'm the director of the metabolic and bariatric surgery program in Birmingham, Alabama. Pretty high volume program, several surgeons, little dabbling in obesity medicine also. So we do a little bit of everything, a little back on track, a little everything. But that's me in a nutshell.
And I know in the 2 years now that I've gotten to know you, you have a beautiful way of kind of checking people in the kindest of ways, right? Because you know what this feels like to be a patient and a provider. You can see things that are happening in your professional world. And I know you're concerned about the impact that it's going to have on a patient because you are one as well. And your insights into where you hope the future of obesity medicine goes is really what this conversation is all about today, right? We want to see the standardization of obesity care in America and in the whole world, right? Having surgery or treating obesity should not be a weird thing. It should be just a standard of care.
Yes.
But yet, right, that care has to be individualized because every person is different. So will you kind of start us off by explaining what this philosophy is for you and how you see it benefiting patients?
Yes. So I like to first really drive home the point that obesity is not a failure of willpower. It's not a psychological condition. It is a chronic medical condition. It follows the same continuum as others like diabetes, high blood pressure, cancer. It's progressive. It's relapsing. It gets worse as we age, and we have to normalize that. I always make a joke, and this is probably so politically incorrect, and I'm sorry, but it's not a sexy disease, right? Like
we talked about this before.
It's not sexy. Like there's not a pink ribbon or anything like that. And but it's real. And millions of Americans struggle with this chronic medical problem every day. And I think we are on the cusp of a revolution when it comes to obesity care, I do believe that with the introduction of GLP-1s, it shed light not only on bariatric surgery and on normalizing care, but on on all the tools that we use to treat obesity and kind of normalizing that. I tell people, rarely ever hear someone say, "Ooh, you're on blood pressure medicines. What did you do wrong?" Right?
Hmm.
"Oh, you have cancer? Oh God, you need to just walk more and eat less," right? But why? Well, why is one chronic disease treated differently? I do think that as we navigate through these treatments, though, we have to acknowledge that when you decide to have bariatric surgery, when you decide to take that step, I don't see it as a last resort. I know that many people describe it as, a last resort. I don't
Hmm.
see it that way. I see it as a formative treatment that should be utilized early. But when we decide to make that decision, wherever you are in that journey, everything changes about everything, mentally, emotionally, physically, spiritually, your relationships, everything changes. And so as obviously we want to normalize obesity treatment. We want it to be as understood as other treatments, but every patient is not the same. This is a very complex disease. There are psychological aspects. It's very multifactorial. There are endocrine aspects. There are metabolic aspects. There's so many things. Women with polycystic ovarian syndrome. So you can't group every patient into this cookie cutter world of, okay, they're going to have bariatric surgery and they're never going to struggle again. You
Hmm.
can't, you can't do that. You cannot
Hmm.
truly say bariatric surgery is a cure for obesity because
Hmm.
it's not. It's a treatment.
Hmm.
Um,
Hmm.
it's the most amazing treatment. I thank God every day that I made this decision, but it is a treatment of a chronic condition, and
Yeah.
we will walk this journey the rest of our lives. So it has to be individualized, and those of us who work in the field, we have to understand that. Like, I truly don't think that unless you've walked it, I truly don't think that you know what it's like to be on this side of obesity. Um, and so we as providers, we have to do a better job. We have to do a better job in normalizing setbacks, normalizing use of more than one tool, normalizing reoccurrence of a condition that is going to reoccur because it's chronic,
Hmm.
and individualizing that care for our patients. We owe our patients that from the professional perspective. And that's my opinion on it.
I I agree with you. There are things that every patient will go through. Every patient's going to go through a pre-op process. Every patient's
Mhm.
going to go through a surgical process. These bigger experiences are going to be the same, but how people move through those experiences and the tools that they need to navigate them are going to be different.
Mhm.
And just like what you said, if we're taking this cookie cutter approach to this chronic disease, we could be doing a little bit of disservice and setting people up to not experience the full spectrum of
Mhm.
success that they could. So when you're thinking about your professional setting, is the system designed for this individualized
Mhm.
care? And if not, what can you do as providers to move it closer to that ideal?
I would love to tell you that the system that the system is flawless. It isn't.
Yeah.
We are bound by a lot of insurance guidelines, and that's a whole other podcast in itself with
Mm,
insurance companies.
mm,
And there's still a lot of treatment out there that is not evidence based. There's still a lot of things out there that we need to work on. y- I don't think that we as providers, not, and I don't speak for all of us, but I don't know if we do an amazing job with follow up.
mm,
I think that that is one area that we lack. Um, and it's not fair. It's not fair to the patient at all. It's one of the reasons why I started following Berry Nation a long time ago because, after my surgery, I was a nurse. Like I knew the medical side of it, but I didn't know the emotional tailspin that I was going to go through. I didn't realize what was about to happen to me, and unfortunately, I did not seek out therapeutic intervention until it was well past my surgery. Well, I should have done it a long time before.
mm.
Um, I think there are definitely areas that we don't do great. And
Mhm.
that's just from patient feedback. Long-term patients, we we take you to nutrition class. We walk you through this process. We give you post-op dietary stages, and then you get to about day 46, and you're on regular foods, and you get past the first 3 months where everything's kinda miserable, and you food is okay again, and then you're like, "Uh,
Mhm. Mhm.
um, so what do I do now?" And
Yeah.
then you go back to see your surgeon, and you become lost to follow-up, and then a patient will regain, and they'll start to have these feelings of failure, which keep them from coming back to see us.
Mhm.
And that's heartbreaking, honestly, for those of us in the field who care, because we don't want patients to feel that sense of failure. It goes back to the chronic obesity treatment. It's a
Mhm.
chronic condition. But a patient will not have great long-term guidance. They will have reoccurrence of their condition. They'll not want to come back to their surgeon because they feel like, oh, they're going to judge me.
Mhm.
I
Mhm.
I failed. I have this self sense of failing. And I don't. I think that as patients, we have to stop that.
Mhm.
You wouldn't do that with any other chronic condition.
Mm.
You wouldn't do that. We have to stop those stigmatized feelings of shame and the self-directed feelings of shame that we feel. With my Back on Track program, we have a Back on Track program, where patients greater than 2 years post-op can come, and it's called Back on Track, but honestly, a lot of my patients come annually as a refresher,
Mhm.
and it focuses more on the long-term patient and
Yeah.
normalizing these things, like getting into, that, um, we only really measure success till 5 years post-op,
Mhm. I did know that.
and so where do we go from there for the rest
Yeah.
of our lives? We hope to live long, healthy lives.
Yeah.
And so if I could tell your listeners one thing is please don't ghost us. I tell my patients that all the time. Please don't ghost your providers. And if your provider makes you feel like you are less than, find somebody else.
Bingo.
Find somebody else. Um, you know, it's it's your journey, and
Mhm.
you deserve equal, non-discriminatory treatment for your medical condition. We all do.
Mhm. Mhm.
We deserve to not feel less than for our condition.
Mhm. Mhm.
So that's where I think that play like companies like Berry Nation really come in handy because you bridge that gap, and I love it.
Mhm.
I don't feel threatened by it at all. Like, as a provider, I'm like, "Hey, okay, there's a whole group of people out here who are helping us bridge this gap and touch more
Yeah.
patients." There's room for everybody, because we can't. Those of us in the professional side of it, we can't do it ourselves. We
Yeah.
can't. There's too many patients. We can't.
Well, there's too many patients, and part of this equation is right. We as patients are kind of bad with that follow up care too, for a lot of different reasons.
Mhm,
And I think part of the barrier to continuing to access care is that we have more than likely experienced a moment in our life where we were shamed or experienced weight bias from a provider, right?
mhm,
So we're carrying that into any situation. And as soon as we experience weight recurrence, those old feelings and that old mindset of this is, I'm making these choices, I'm doing things wrong, right? We take back all of that blame and shame that we have been trying to kind of
mhm,
offload. And for patients, I think a key message that maybe we as an organization and just as a greater bariatric community need to deliver is that you still need to go to those appointments, even though you are feeling you fill in the blank. You
mhm,
just have to go because if you don't, you are allowing the disease to win again in your
mhm,
life. Because the disease of obesity is working really hard to keep us isolated, alone, right? And living in this guilt and shame cesspool of awfulness. And the only way that you break out of it is you change your mindset around the disease, right? So this is not a decision. I have a disease.
mhm,
And as we like to say in Berry Nation, but once I recognize that, I have some very important decisions to make. Am I still going to go to that appointment that I have scheduled, even though I'm not feeling great about my
mhm,
weight, even though I'm struggling? And the answer there has to be yes. It just does. So when I hear you say, right, as providers, we struggle to offer, long-term care. Sure. But your job, right, as a provider is to move people through those initial
mhm,
stages of surgery because you've got, you know, thousands of people that are waiting for that
Yeah.
same surgery. And where I think the power of people like you and other experts, providers joining forces with Berry Nation is exactly what you said. We can help you bridge that gap. We can be that education, that support, that safe place, right, to learn how to navigate your bariatric life, no matter what stage you're in. And our bridge goes back to you, right? Because the messaging that we deliver every day in our community is that sounds like something that you really should talk with your provider about, right? Your provider is going to be there for you. This is a conversation for them. And if you need the time and the space to work through those feelings and emotions and to practice having that conversation, that's literally what our community is built for. And we are also there to help you find a provider that gets it.
Mm-hmm.
And you and I both know it is a lot of work to find a new provider.
Yes. Oh, it is.
Right? I mean, it's like clothes shopping, right? And you dread going, and I know it. It's like, oh my God,
Mhm.
I'm gonna try on 50 pair of jeans and hopefully one of them will look and feel good. And it's kind of similar to finding that new provider.
Mhm.
But the payoff for you putting in the work to find a provider that really fits for you and doesn't shame or blame you is that you are going to find that person who will be your partner for life. You will find that person who you're not afraid to say the scary things with, and you'll find a provider that truly wants to help you continue to treat this disease. Right? When we find that pair of jeans and we're like, these are the perfect jeans, you're going to have that same feeling when it comes to a provider.
And these conversations, they're going to be uncomfortable, and that's okay.
Mm,
I say you have to get uncomfortable to be comfortable. I do
mhm.
not live in, I do not live in fairy tale bariatric world. My patients will tell you that. I tell them the good, bad, and the ugly. We're very candid. In our support groups, we're very
Yeah.
candid. You know, it's like Vegas. What happens in Vegas stays in Vegas.
Yeah.
But we have to normalize though the uncomfortable topics. The going back.
Mhm.
Tell your surgeon, I've had a trigger. Something has happened. I'm having habits that are scary. I am starting to lean more towards the eating disorder side of things. I'm eating in secret. I'm binging. Don't be afraid. I'm drinking too much.
Mhm.
So there's a very substantial rate of transfer addiction after bariatric surgery. Does it
Mhm.
mean that bariatric surgery is a bad thing? No, it means that if you are using food, and I have in my career, I've come across some stories from patients that will just break your heart. Things like child abuse and horrible childhoods, horrible things that have happened to people that have led them, to where they are today. And I tell people, you've got to be transparent. You've got to be open. If you are utilizing food as a way to treat an emotion, as a way to shelter, you've got to watch yourself closely after surgery. Do
Mhm.
my surgeon is sometimes like, can you like tell them the good things about surgery? I'm like, I tell them the good things. We're gonna normalize that. My favorite thing to say is, God, the first 3 months suck, y'all. Okay. And we're gonna normalize that. Okay, let's
Yeah.
let's normalize. You're not crazy. You're not losing your mind.
Yeah.
You're not doing anything wrong. It's a little rough. Okay. It's a
Mhm.
little rough for a minute.
Mhm.
But we gotta normalize that. We gotta normalize these
Yeah.
conversations. We've got to normalize conversations where you're frustrated, where you're tired,
Yep.
where you want to give up, where you don't want to be a bariatric patient anymore. You want your identity to be something else. I'm currently in
Mhm.
that phase kind of right now where I'm like, hmm, does my whole identity revolve around bariatric surgery? And so we ebb and flow through that. And you're not crazy. You're absolutely not
Mhm.
crazy. If you ask 5 other patients, okay, let me tell you what's going on. Like, I'm afraid of food. Am I crazy? They're gonna be like, oh no, girl. Oh
Mm-mm.
no. I had that too. Everything's gonna be fine. And then
Yeah.
so like the support that patients get from Berry Nation, sometimes just feeling normal, sometimes just
Yeah.
being able to say, man, this is a wild ride. And having somebody else say, I know, girl, I know. Sometimes that's
Mhm.
the best thing that a patient can hear is somebody else just saying, yep, I get it. We're fighting this together.
Oh, I think it's the best thing, period. Because when you can say, and I probably already said this in this episode, but it's just been on repeat in my soul. When we can say the scary things out loud, and we are met with compassion
Mhm.
and support and empathy, all of a sudden the scary thing becomes not so scary. You can feel its power over you diminish.
Mhm.
And that is really that pivotal moment when things can change.
Mhm.
And you don't have to know what's wrong to start that process. All it takes is you just saying, right, to somebody else, something's off. I don't feel right. I think I'm feeling angry. And it's even okay if you don't know what it is or you don't
Mhm.
know the name of it. But when you start that dialogue, it will come. You will discover it through that conversation.
Mhm.
Again, which is why the support groups that happen synchronistically, right, at the
Mhm.
same time, either in person or virtual, are so important because you're having an in the moment conversation. Your brain is connected
Mhm.
to your heart and to your emotions, and you can clarify things, and you get that out, and you're like, oh, that's what it is. And once you know it, you can move forward.
It's a beautiful
And
journey. This
oh, so
it,
beautiful.
it took me a long time to get there. It took as a patient. It's a wild journey, and it's
Yeah.
a
Oh.
lifelong journey. I always say it's a marathon, not a sprint. Slow down,
Mhm.
but
Mhm.
it's a beautiful journey. It's hard, and it's hard emotionally, and everything about tangential relationships and societal norms and body dysmorphia and all the things that come along with it, and everything about everything you know about yourself, about
Mhm.
others, about food, about everything you know starts to shift. And I think that is one thing that we maybe don't tell patients. And if we focus really great on hydration and protein and take your vitamins. By the way, please take your vitamins. But but we don't we don't always talk about the body dysmorphia.
Mm-mm.
The years of living in a body that was larger, and then you still see it for the rest of your life. The rate of divorce after bariatric surgery, the even tangential relationships with coworkers, your children, your parents. I live in the South, right? The deep South in Alabama. And food is not just food here.
Mhm.
Food plays a huge role in societal norms, especially like when
Mhm.
somebody dies, we bring like everything we do. And one thing that we have to navigate here in the South, um, I'll find that patients will say, my family was super on board until after surgery.
Mhm.
And then they started acting weird. And then we have to have that conversation about how did they show love? Well, she used to cook for me. My grandmom used to cook for me. And like, okay, inadvertently, what's going on right now is there's a relationship shift. Um,
Mhm.
th- you're essentially, rejecting, even though you're doing it inadvertently, their method of showing love, and things get interesting. Things get interesting after
Mhm.
surgery with when you. I like to tell people you think you feel better about yourself. You think that, oh, I'm going to have surgery. I'm going to get to my goal, and I am gonna love my body. And then you get there and you're like, "Ooh, hmm,
Mhm.
okay, not so much." The compliments are fun at first. They're not
Mhm.
fun later. Um, and then, you start digging into plastics, um, which is a whole other beast with
Oh,
loose.
yeah.
And I have undergone 3 rounds of plastics. And it's a journey that doesn't end. It's not like going to get
Yeah.
your gallbladder taken out other than, like, a little post-op diarrhea. You go
Mhm.
back to normal the next day.
Right?
It's it's not. It's not anything like a normal surgical procedure. I don't think that we
Yeah.
tell people that.
No, which was kind of at the heart of this conversation, right? It's like bariatric surgery is one of the safest surgeries
Mhm.
on the planet. And, you know, some of the foundational things are the same. But when you have your gallbladder out, nothing really in your life changes. Your relationships don't change, right? Your relationship to self doesn't change. But when you undergo bariatric surgery, every connection that you have in your life is going to go through a shift because you start to realize just how connected the disease is to every facet of your life. And to be unprepared for that is overwhelming. And to be scared by those shifts sometimes is even worse. Because if you're scared by that, you are not going to go through the change that is kind of required of you. And you're going to stay the same, which means you're going to find yourself at the same weight, thinking the same thing, doing the same thing, frustrated with the same thing. Because sure, you've went through the surgery, but you have resisted the change and the work that is required for the surgery to be effective.
You know, I laugh with my patients. I cry with my patients. I absolutely love watching the evolution of someone
Mhm.
as they fight this disease. It's not, I don't, I'll be honest with you, I don't put a lot of stock to the number on the scale. I am that provider that will, you start talking about the BMI and I'm like, "Bleh, whatever."
Mhm.
I don't, when a patient tells me what's my goal weight, I don't tell them. I'm like,
Mhm.
let's think about something else. When a patient tells me I tied my shoes, I sat
Right?
on the floor to wrap Christmas presents, I was able to have a child. I've had a couple of patients that were able to get on the kidney transplant list and get kidney transplants. That's why. That is
Mhm.
why I do this. And that is why so many other of my colleagues, and I'll tell you, I've never in my life seen as many amazing people, integrated health surgeons, mental health providers, nurses, as when I really got active in SMBS. And we we love our patients. Like they're
Mhm.
the most amazing people,
Mhm.
and I just I love my patients. They're fighters. We're fighting a disease, and I'm right there
Mhm.
with them. I'm fighting it with them. I will never tell a patient that I'm perfect. I don't think that does them a I don't think that does them a good service, to see me.
Yeah.
And I'm very open about my journey. I am very open with patients about my surgery, about my weight loss, about my plastics. I don't hide it. I don't feel like hiding it makes me a good provider, because if I normalize it, if I say, look at me, I'm a provider. I'm a
Mhm.
provider who works in the field of bariatric surgery. And I'm also a person who struggles. I'm also a person who has the chronic medical condition of obesity. And you can be both. You can work in this field and help fight obesity and help bring about change for this condition and be affected by it. And
Yeah.
I think that the ones of us, and I know several in this field that have bariatric surgery, the ones of us who normalize it and are open about it and say, I'm with you. I fight it too. I live this life every day. I think that sometimes the patient will go, okay,
Mhm.
if she can do it, and if she can do it, I can do it. And she knows how I feel. She knows
Mhm.
she knows that some days it's not fun. Some days it's hard. Some days you grieve. Some days you cry. Some days you throw things. Um, but it's worth it. It is 1,000 times worth it.
Earlier, you talked about we have to get comfortable being uncomfortable. And what comes to mind when I have been hearing that phrase recently is this realization. It's not that I have to get uncomfortable being uncomfortable. I have to get comfortable with continuing to be uncomfortable for the rest of my life, right? Because before surgery, I was very uncomfortable in social
Mhm.
situations, in my personal life, in my physical capabilities. Everything that I did was impacted by that disease, and I was constantly uncomfortable.
Mhm.
And I think where patients get hung up is an unrealistic expectation that after surgery, I will never be uncomfortable again,
Ugh, I wish. I
right?
wish.
And it's just not true. We set ourselves up a little bit for this feeling of failure because we get on the other side of the surgery, we recover, we're in the honeymoon stage, and we're like, "Oh, this is great." And then all of a sudden life keeps lifing and we find ourselves in uncomfortable situations again. And we think to ourselves, "What the heck? I had surgery so that I would never have to feel this way again." And then surprise, here are old familiar feelings and emotions and situations that continue to make us uncomfortable. And I think when we feel the way that we used to feel, our brain instantly goes, "Oh, you've been here before. Oh,
Mhm.
nope, nothing has changed. Like this is you're the same person, you're doing the same thing, you're thinking the same thing.
Mhm.
Why did you
Look,
have the
you
surgery
did
in
it
this first place?"
again.
Right?
Well, because we've been told that, you go to the doctor and maybe you did a crash diet like we probably all done. I mean,
Mhm.
or my mama put me in I was in Weight Watchers at like 12, okay? And you maybe lost weight at your last one, but you gained it, and they're like, "Oh, you've gained weight," like, you're constantly reminded
Mm.
of your past, of going back there, and it
Mhm.
becomes a fear. It becomes almost a phobia of, I don't wanna go back there. I don't want to be there again. I do tell people, and I know this is such a cliche thing to say, this is one of those, like, Amy tells it like it is. If you think in any way, and I'm saying this as a provider, as Nurse Amy, as they call me, if you think in any way that this surgery is magic and that you are going to wake up from surgery and you are going to lose weight and everything in your life is going to be amazing and you're going to win the lottery and everything is fabulous and you're going to have the body of a 20-year-old supermodel, no,
Mhm.
shift that way of thinking.
Mhm.
I saw this meme once and it stuck with me, and it was a little bit on edge, but it had a picture on the left hand side of a very, like, very small supermodel, probably like a size 2, crop top, short shorts, okay? And the caption above that said, "What I think I will look like after bariatric surgery."
Mm.
And on the other side, there was a woman in probably a size 12, very, very normalized looking, slacks and a sweater, and it said, "What I actually look like." And that stuck with me
Mm.
because our bodies are damaged from years of our chronic condition. So you have to go into this with some realism that I am not doing this to be skinny. I am doing this so that I can be a participant in my own life. I'm doing this to save my life. The day I decided to have surgery, and this story, it almost, what, 9 years later, it still gets me. I had a patient, a young patient who, I was right around 400 pounds working in the emergency department. It was horrible. I was miserable.
Oh.
Uh, Diabetes, high blood pressure. I was
Mm.
not an active participant in my life, could not have children. Just a very difficult situation. And I had a patient come in and I was attempting CPR. He was young and he was cardiac arrest, and I physically could not.
Mm.
I could not do more than maybe 45 seconds. And I started to have chest pain. And I was in my 30s. I'm 40 now, but chest pain went down my arm. And I was like, oh my God, I, my entire life, I wanted to be a nurse. My entire life, I wanted to help people. And my body won't let me do that. And that is the
Mm.
day that I decided to have bariatric surgery. And
Wow.
I made a consult the next day with the surgeon at the hospital I worked at because I felt so much sadness that the one thing that I'd wanted to do my entire life, which was help people, my body wouldn't allow me to do that. And
Mm.
I still carry a lot of guilt from that situation. It did have a good outcome, but I carry a lot of guilt that
Yeah.
my breaking point, my lowest point as a professional and as a patient was that I couldn't care for somebody.
Yeah.
And I think we all have that breaking point. I think we all have that point where we say, you know what, it's time. And
Yep.
everybody's is different. You can't push people.
Um.
You can't force people. You can be encouraging. You could say, I get it. Like
Mhm.
I get it because I walked it and this is what I did and it changed my life. When you get ready, when you're ready, come talk to me. When you're ready,
Mhm.
let's talk through it. And that's kind of where I leave it with family, with friends. I have a lot of friends that come to me and ask questions and I answer them
Mhm.
very honestly. I don't ever push anybody because you have to be ready for this.
Yeah.
You have to be ready for this journey.
What I realized, a couple years after surgery was my my breaking point, came kind of very quickly, and it was spurred on by a friend, which is great. But a year or 2 after my surgery, I was talking with my friends, and they were telling me stories about how they would plan our vacations or time together based on what they thought I could physically do. And that guilt and that break came years after my own procedure. But what's powerful, I think, no matter where you are in your journey, having these moments connects us deeply to the reason that we made this choice in the first place. So on those difficult days, we have something to anchor our reality to, right? Like, I did this for this reason, and there could be plenty of reasons for that. I also went into surgery 99% sure this would work. I don't know if I was ever going to get to I'm 100% sure this is right for me. But I knew that if I continued to live the life that I was living, it was never going to change and it was only going to get worse. So I committed to having surgery, not 100% sure. But what I did tell myself is you will do anything and everything you need to do to continue to work the surgery. And I think sometimes we hold ourselves back because we're not to that 100% yet. But it's a real easy, I think, A/B test that we can run for ourselves. Before you go to bed one night, if you're struggling with your weight and you've just been wondering what the heck you're going to do, just tell yourself, I'm going to have bariatric surgery. I'm going to commit to having surgery. Just tell yourself that. Even if you don't 100% believe it, even if you're like 1% true, tell yourself that. Sleep on it. And the next morning when you wake up, check in with yourself. How do I feel about my decision to undergo bariatric surgery? That's going to tell you all you need to know. Because if that thought or that idea stays settled in you, you're ready. If that idea doesn't and you're met with something else, then you're not. But the more that you have this conversation with yourself, the closer you are going to get to treating your excess weight, the disease, differently than you have in the past.
And I kind of see it this way. Patients will ask me, is bariatric surgery safe? So and so, my so and so sister in
Oh,
law,
yeah.
everybody knows somebody, right? It's
Oh, yeah.
somebody who had surgery and like their left toe fell off, and somehow that's his fault with the surgery.
Yeah.
It's a thing. I could joke about it, but it is a thing. I look at them and I say, let me ask you. This is once again where I realize. Let me ask you a question. Is bariatric surgery safe? By the way, if you stack up the science, it is safer than a gallbladder removal. Just a fun fact. But
Mhm.
I say, do people die? Yeah, absolutely. Do people have complications? Yeah, it's a
Mhm.
surgery. Where you are right now, though, you have a 50 to 100% chance of dying prematurely.
Mhm.
This disease will kill you, and not in
Mhm.
a quick way, in a miserable, exhausted, stacking on other comorbid conditions type of way. And at some point when they say, "Is bariatric surgery safe?" I say, It's safer than continuing the path that we're on. It's safer than dying slowly." And I remember laying on that stretcher, very and knowing a little too much about, being on this side and think, little too much, wish I didn't know, what happens. And I remember thinking, "Okay, this something." I mean, I'm not in amazing shape, okay, let's just be honest, I got high blood pressure and diabetes, okay? I'm 415 pounds, my heart's probably not great, and could something happen? Absolutely.
Mhm.
And I remember laying there thinking, I'm choosing to have
Mhm.
surgery. I'm choosing this treatment, and I had to shake myself and had to say, "Well, girl, you're 32 years old, and you can't get on the floor. You can't you can't do things. You can't live a normal life." And so you know what? I said this, and my family laughed at me. I said, "Well, if I die, I die. Like I don't know what to tell you. If I die, I die.
Yeah.
At least I will have died fighting. At
Mm.
least I will have died fighting my condition,
Mhm.
and I will go out in control at this point." And I think that's the way we have to look at it. Is it is a procedure. It's a medical procedure, and it is
Yeah.
serious. And I am on that side. Like, I do see the realities. I think sometimes, though, the mental reality is a lot harder than the physical reality. Um,
Mhm. Oh.
I actually see more patients struggle with the mental reality than the
Mhm.
physical things. Once you get past the 3 months is
Yep.
pretty bad. Let's just normalize that. But
Yep.
I think that I would say a good, and I'll be honest, I've had patients that have had complications, and I call it buyer's remorse. And I think we all probably had a few moments of that when you were sipping out of medicine cups, and
Mhm.
it wasn't the vibe, right? And you're like, "Why'd I do this? Why'd I do this?"
Mhm.
And then 6 months to a year down the road, you're like, I made it. I lived. I'm not drinking out of medicine cups anymore. But even patients I've had that have had a rough start to their journey, later on, you come back and you ask them, and I would be fine if they said that they wish they never did it. Like, I think that we have to validate that, but they'll say, it was worth it.
Hmm.
And that really sums it up. I think that I think that we have a long way to go in obesity treatment. I think that we've come a long way.
Hmm.
I mean, even in the techniques of bariatric surgery, even in the procedures, going from open procedures
Oh,
where you
yeah.
spent weeks in the ICU. I have family members that I remember being a teenager, and my aunt had bariatric surgery. And this was back in the 90s, and I remember going to see her in the ICU, and she was the first person I knew that had a gastric bypass, and she had an NG tube, and she'd been in the ICU. I think that getting into robotics and minimally invasive bariatric surgery, patients are going home the same day, and it's just
Yeah.
this amazing way that we have revolutionized this treatment, and now we're seeing adding in GLP-1s, and
Hmm.
I'm a huge proponent of GLP-1s. I know that not everybody who works in the field of bariatric surgery is always on board with other forms of obesity treatment. Me, myself,
Hmm.
I am, and I love to see it in post-ops. I
Yeah.
will tell you guys this, if you are a post-op who is struggling, you have other options too, and it is perfectly fine. It is perfectly
Hmm.
fine to utilize a GLP-1 in your journey because it is another tool in the toolbox, and I don't ever wanna see anyone feel guilty about that. You
Hmm.
wouldn't feel guilty if your blood pressure medicine stopped working and you had to transfer to another one. Nobody thinks twice about
Correct.
that.
Nope.
So why do we beat ourselves up because we have to
Yeah.
utilize more than one treatment? That's
Yeah.
my view on GLPs. I am a huge, huge proponent of GLPs used responsibly
Oh, yeah.
and under correct medical supervision is probably the most amazing thing for our post-ops.
Yep. Well, I mean, it's a perfect way to bring this conversation full circle. Normalizing the multiple modalities of treatment that the disease of obesity requires is extremely important, right? For practitioners and for patients,
Mhm.
because it allows us to access the the full toolbox, if you will, and choose the tools that we need based on our life, our goals, and our disease. It's that individualized care. It's normalizing
Mhm.
all of the treatments, and it's using those options to individualize care so that everybody truly can treat the disease in the most
Mhm.
impactful way for them.
Exactly. Exactly.
Amy, this conversation has been amazing. Amazing. Thank you so much for joining us and for being so real, so honest, so truthful, and to share a big part of who you are with us. As you said, that's what helps normalize treatment for everybody.
I'm just a post-op. I'm just a girl living her life, treating her medical condition, and pulling others along with me on the way. And if you live in Alabama, um, if you're thinking about having surgery, if you're on the fence, if you just need to ask some questions, like no pressure. I'm not going to be like, hey, you've got to come see my surgeons. I'm not that kind of person. Um, you know, if you're in Birmingham, or well, where we have patients come from other states, but reach out and ask me questions. It's perfectly normal. It's perfectly fine. I'll answer them probably a lot more truthfully than you really want the answer to, but I love sharing this journey with other
Yep.
people. It's a wild ride, I'll tell you that. It's a wild ride, but I would trade it for a second.
Oh, Amy, thank you again for joining us. And friends, I'll make sure that all of her contact information is linked below. She does have a social media presence, and I'll also include an email address for her if you would like to reach out and talk about onboarding care or what your next steps could be. And I know Amy really talked a lot about the additional support that she sees her patients needing: transfer addiction, emotional eating, preparing for surgery. We offer all of those adjunct educational supports in the Berry Nation membership community. So if you would like to see what those supports are all about or explore the community, I will link our community events calendar in the show notes so you can see all of the amazing support that we offer, as well as a link to join us at a practice partnership rate. Because Amy and I both know the support from peers and experts is a critical piece of our obesity treatment journey, and we're here to support you for
I've
that.
been fangirling on Berry Nation for a long time. When you asked me to be the podcast, I was like, "What?"
Girl, I've been fangirling since the moment I met you. If Laura Gramo says you need to meet somebody, you need to meet somebody. Thank you for the opportunity to spend more time with you and to share your story. It's been amazing to get to know you, and I'm excited to invite you back and see you leading in the Berry Nation community.
Thank you. Thank you so much.
All right, friends, share this episode if you think it was impactful, and we'll see you next time. Bye, all.
That wraps up another empowering episode of the Berry Nation podcast. If you enjoyed today's episode, keep the conversation going by joining the Berry Nation membership community, where you can attend live support events, access on-demand resources, and find a caring community.
Join us at berrynation.mn.co. If you found this podcast valuable, help us produce it by becoming a $5 monthly supporter at berrynationpodcast.com.
And just remember, at the end of the day, you've got this, we've got you, and we'll see you next time. Bye, everybody.